On this Saturday night, cases of COVID-19 climb in Canada. The virus sweeps the country.
We need to focus on clusters so we can stop those transmission chains.
While Quebec declares a health emergency decree.
All elders to stay at home.
Canadians abroad told to return home ASAP as Donald Trump expands his travel ban to include the UK and Ireland.
They've had a little bit of activity, unfortunately.
The American president confirms he's finally taken the COVID-19 test.
I also took the test last night. Yeah.
Plus, freedom at last. A Canadian woman and her Italian travel companion escaped their captors in Burkina Faso.
Global National with Robin Gill.
Good evening and thank you for joining us. We begin with a warning for Canadians overseas. The federal government is urging travelers to come home now while commercial flights are still available. U.S. restrictions on flights from mainland Europe have gone into effect and will now include the UK and Ireland. Many countries in Europe are sealing their borders and shuttering businesses and public spaces because of the COVID-19 pandemic. We'll have more on that in a moment, but first, the situation here at home. Across the country, at least 240 people have tested positive for COVID-19. Ontario has 26 new cases as of today. There are now more than 100 confirmed cases in that province alone. BC has the second highest number of cases with 73. 3 new provinces are reporting cases today. Prince Edward Island confirmed its first case. Newfoundland and Labrador has 1 case, and Saskatchewan reported its first 2 presumptive cases. Elsewhere, New Brunswick is dealing with 2 cases. There are 4 in Manitoba, 39 in Alberta, and the number of cases in Quebec has risen to 24. Quebec's provincial government has adopted a health emergency decree that will be in place for 10 days. Abigail Bimman has the details in our top story tonight.
I like that one right there.
Visiting from Boston, the Fernando family explores this Toronto aquarium, one of the few major attractions open.
It was getting scary coming up to the date, but we figured we're going to do something this weekend, it being my birthday, whether it's Boston, whether it's somewhere else. What's the difference?
Right now we're staying open, and as I said, we monitor it hourly. We know exactly how many people are entering the building, exiting the building, so we do control the amount of people in the building, so we keep it lower than what it normally is.
The new coronavirus making for a tough start to March break, but lots of people aren't staying home.
We're keeping our distance, we're washing hands, we have hand sanitizer. I don't know how many containers of it we've got with us. 3. Yeah.
We have to be alert and responsible.
Friday, Ottawa asked Canadians to avoid travel outside the country. A tweet from the Foreign Affairs Minister Saturday took things a step further, recommending those already abroad come back via commercial means while they are still available.
All travelers coming to New Brunswick must continue
At news conferences Saturday, many provinces echoed the federal message and in some cases took it further.
If you travel abroad, you could be subject to the measures of other countries. Your 1-week trip may become much longer. You may also have reduced access to quality health care.
I would like today to ask all Quebecers over 70 years old, so all elders, to stay at home. And I would like to ask all Quebecers that can help them getting, for example, some food, to do so.
Prince Edward Island declared its first case of the new coronavirus, while the Premier announced he's self-isolating with his family after spending less than 24 hours in the United States. Nationwide, people have questions and healthcare phone lines are overwhelmed. In Manitoba, they're hoping some helping hands will cut down on wait times.
We've had lots of interest from physicians, nurses, students, retired people, and we are very grateful for that, and we will definitely make use of that.
Ontario is limiting the volume of test swabs supplied, citing an increased demand. And in BC,
people with mild symptoms and returning travelers who are isolating at home do not need to be tested unless you get sick enough to require health care.
Both provinces stressing it's all about making sure those who really need the test get it. Abigail Bimman, Global News, Ottawa.
In the U.S., Donald Trump has expanded a travel ban that now includes the United Kingdom and Ireland. There are nearly 2,500 confirmed cases in America. Now, the administration is taking measures to check anyone coming in contact with the president and vice president for symptoms of the respiratory illness. Trump says he has been tested for the new coronavirus. The test came back negative. But as Jennifer Johnson explains, many average Americans are still waiting for a test to be made available to them.
As the number of Americans infected with COVID-19 rises, a show of force from the White House task force, again attempting to calm U.S. citizens.
We're using the full power of the federal government to defeat the virus. They want to get it over with quickly and with very little death.
The president's ban on travelers from 26 European countries into the U.S. went into effect at midnight. Now that list will include the U.K. and Ireland as of midnight Monday. But it's Americans overseas who are struggling to get home as airlines reduce flights.
We were hoping that, the government would take more concern about this, that airlines would make more of an effort.
The bill is passed.
Early Saturday morning, U.S. House lawmakers overwhelmingly passed a bill providing free COVID-19 tests for all Americans and paid emergency leave for workers sidelined by the pandemic.
If you are sick, you need not be concerned about staying home. If you're sick, stay home. You're not going to miss a paycheck.
Officials say millions of test kits are rapidly being made while more communities roll out drive-by testing sites.
The actual swab is pretty fast.
Hospitals are taking extraordinary steps. Cedars-Sinai Medical Center in Los Angeles has set up tents to treat patients in its parking lot. Doctors across the U.S. already reporting a shortage of masks, protective clothing, and other critical items.
What do we do if we have a limited number of ventilators?
The nation's top health official says they are now mass producing more masks and other equipment for hospitals, but warning vulnerable Americans are still at great risk.
We will see more cases and we will see more suffering and death.
The U.S. is becoming increasingly paralyzed by the pandemic. Normally bustling Penn Station in the heart of New York City is now a ghost town. Millions of students from kindergarten through college have been ordered to stay home. Businesses telling employees to telework. Americans limiting their exposure as the U.S. braces for a surge in cases of this deadly virus. Jennifer Johnson, Global News, Washington.
In the UK, the number of deaths doubled in just 24 hours. Spain is seeing a sharp spike and has ordered a 15-day national lockdown. So schools, restaurants, and bars in that country are closing. The World Health Organization has labeled Europe as the new epicenter of the coronavirus outbreak. But as Redmond Shannon reports, one of the big headaches in that part of the world is that dozens of countries are all tackling the crisis in different ways.
At the stroke of noon, Italians show their appreciation for their health professionals as the lockdown nation deals with a staggering death toll. Italy, so far, the worst hit country in Europe. But Spain is following closely behind, appearing to be on a similar trajectory. The country will observe a 15-day lockdown with only essential services like pharmacies and grocery stores to stay open. This Spanish doctor is pleading with young people to play their part. He says while young people may not suffer serious symptoms, they can easily pass on the virus to the vulnerable.
It's hard because, as you know, Spanish people, we love being outside, we love socializing, have a beer on the street.
Cristina Rodriguez is in Madrid. Her parents are a doctor and nurse. She says social media campaigns like this one are making a positive difference.
What we need to is kind of like stop the curve from going up and just making it kind of slow down a bit, because what we don't want is to collapse hospitals.
Elsewhere, Poland and Latvia are among nations that will completely shut down their borders. And as Donald Trump adds the UK and Ireland to the US travel ban, questions continue about the strategy being taken by British leader Boris Johnson. Based on advice from government scientists, the UK has not banned public gatherings or closed schools.
Hope you're all spaced out.
Leaders from Northern Ireland, which is part of the UK, and the Republic of Ireland met on Saturday to try and harmonise their strategies either side of their open border.
There will be differences, but the differences that exist are mostly around timing.
There are reports that the UK may follow its neighbours and ban mass gatherings as early as next week. And now France has followed the drastic actions of Spain and Italy. Most stores, restaurants and entertainment facilities will be closed from midnight on Saturday as Europe slowly grinds to a halt. Robin?
Redmond Shannon in London. Japan's prime minister isn't ready to declare an emergency. Shinzo Abe says the 2020 Tokyo Olympics will go on despite other sporting events being cancelled. The death toll in Iran has jumped, and satellite images from space show newly constructed mass graves, suggesting the true scope of the outbreak is much worse than that country is reporting. In East Africa, the first COVID-19 cases have been recorded in Kenya, Ethiopia and Sudan. And New Zealand is cracking down on arrivals, imposing a 14-day quarantine on anyone flying into the country as of Sunday. Apple is closing all of its stores outside of China until March 27th, but it's reopening stores in China where the pandemic began because new cases there are in decline. In a statement, the CEO says the move is to reduce density and encourage social distancing in response to the global spread of COVID-19. Tech support and shopping will still be available online, and staff will continue to receive their wages. The disruption being caused by COVID-19 is unprecedented. Some countries are closing borders and slowing manufacturing, which will impact global supply chains. And those measures could affect the Canadian economy. Mike Ligatur is looking into that for us tonight. Mike, guide us through what's happening.
Well, Robin, as provinces and territories try to stop the spread of the new coronavirus, some are limiting the number of people who can gather at one time, while hockey rinks and museums are being closed. That will undoubtedly have a heavy impact on the Canadian economy, which is already suffering from the earlier rail blockades and the drop in oil prices. The federal government is working on what they're calling a significant stimulus program to be presented next week. Now, no one thinks the government will try and spend its way out of this healthcare crisis, but the Business Council of Canada told us a long-term plan is needed.
I would suggest that the Minister of Finance and others may want to look at an economic advisory committee that perhaps is tasked with the mid to long term. What will that recovery look like? Because we don't want to arrive at the other end and say, now what do we do? Why don't we have people thinking about that as much as we have people thinking about the immediate and the short-term implications?
A part of that plan includes the federal budget, which was supposed to be delivered on March 30th, but has now been delayed because of COVID-19. And some think the finance minister should tear it up and start from square one.
I think so. I think clearly this is the primordial economic issue we're going to have to deal with. It's going to be very difficult for the government to pivot that quickly. Obviously, you know, this is a classic black swan. This came out of nowhere. Nobody was expecting this. The whole budget planning cycle was going into other priorities, but I think they're going to have to pivot.
The question is, will the government heed that advice and make a major pivot? Robin?
Mike Ligatur in Ottawa. Thanks, Mike. We know you have lots of questions about this virus. Our Jeff Sempo will consult with experts and try to answer them. So email us at yourquestions@globalnews.ca. And our website has a page dedicated to the new coronavirus. Go to globalnews.ca/coronavirus. Coming up, how a Canadian woman held captive in Burkina Faso managed to escape her kidnappers. There is relief tonight for the family of a Canadian woman who was abducted in West Africa more than a year ago. The Canadian government confirms that Edith Blais and her Italian companion Luca Cicchetto were located in Mali. In December of 2018, the pair was traveling by car in Burkina Faso, heading to Togo to do volunteer work when they disappeared. Al-Qaeda and other terror groups are active in that area of West Africa. Sources say the pair fled their captors, flagged down a private vehicle, and were dropped off at a United Nations checkpoint. Russian President Vladimir Putin has signed a new law that could keep him in power for 16 more years. Under the current constitution, Putin's term should expire in 2024, but the new amendment will allow him to run for 2 more terms. The proposed measure sailed through Russia's parliament this week with only 1 vote against it. It must now be approved by the country's constitutional court and a nationwide referendum next month. Microsoft co-founder Bill Gates is stepping down from the company's board. Gates says he is leaving the tech giant to focus on philanthropy. He was Microsoft's CEO until 2000. Since then, he has gradually reduced his involvement in the company. Gates is one of the richest men in the world. He co-founded Microsoft with his childhood friend Paul Allen in 1975. He and his wife will continue to run the Bill and Melinda Gates Foundation. Still ahead, the daunting new risks for the homeless during this global pandemic. Right across Canada, homeless shelters are on alert for COVID-19. It's a segment of the population already at high risk with any serious virus. But as we are now learning, the new coronavirus can be devastating. As Mike Armstrong explains, shelters and missions are already cutting services, planning for worst-case scenarios.
It is a population without many of the things most take for granted. Not just a bed, but also things like sinks and washrooms, places to keep clean. Put hundreds of homeless people together in a shelter, eating and sleeping close together, and you have the perfect recipe for a virus like COVID-19 to spread.
We are at a heightened risk. We can't change that. That's the way a shelter is.
Shelters are ramping up cleaning procedures. They always worry about germs, even at the best of times, but this is different. The homeless population is at a higher risk from COVID-19 because many already have other health problems.
A lot of them have respiratory tract illnesses, chronic heart disease, hepatitis C.
Much of the last week has been spent on education and vigilance, making sure people already vulnerable were careful. But the worry now is turning to what if? What would it mean if COVID-19 got into the homeless population? Most big cities' shelters already hover around 100% capacity. What if people have to be quarantined?
If at any point anyone is asked to self-isolate, how are you going to self-isolate if you don't have a home to go to?
Some of the harder hit areas in the U.S. have already taken special measures. A county in Washington state bought an Econo Lodge motel and has turned it into a quarantine facility for the homeless. While the city of San Francisco has leased 30 recreational vehicles and parked them.
Well, I think that the mayor and the city has made it very clear that our number one priority is vulnerable populations.
In Montreal, the 4 major shelters are always in close contact. They've dealt with threats together before. Back in 2017, it was an outbreak of flesh-eating disease. They are now cutting some services. A warming center is closed as of this weekend. Some are suspending volunteer activities. They're also only serving meals to people staying at the shelters. People from off the street can only get meals to go, and many understand why.
Virtually everybody that we come into contact with has heard about COVID-19 and is concerned.
Now, there are worst-case scenarios being studied. Shelters and missions don't have big reserves of cash or extra facilities they can open up. Well, one Montreal shelter says it's considering making an appeal Monday, requesting the military be deployed to help with the homeless population. Mike Armstrong, Global News, Montreal.
Up next, hidden crime, hidden victims, supporting survivors of sex trafficking. Human trafficking is a hidden crime in Canada, making it difficult to track the number of victims. Recent data from Statistics Canada shows that 90% of sex trafficking victims are females between 18 and 24 years of age. But the stigma often prevents them from coming forward. Jamie Dahl shows us how one police officer is trying to change that.
Not every sex trade worker is wearing a miniskirt with fishnet stockings.
11 years he has combed these streets, often undercover, diving deep into a hidden world where girls and women are exploited and sold for sex.
The trafficking that we see more often than not in Canada is not what you see in Taken. It's happening at a much more organic level than what Hollywood would depict. It's nice to see that the police are out here checking on her welfare.
It's 9:30 in the morning on a Tuesday. The Calgary Vice Unit's Detective Paul Rubner is showing us one of the city's last remaining strolls. It doesn't take long until we get pulled over by a patrol officer who suspects Rubner is a John.
I thought that was you. I was going to send you an email. We're now patrolling this area.
What's her story?
Works out here part-time. Kind of a hard luck case, young girl.
Yeah, she doesn't look very old.
Yeah, she's 20.
Just let her know if she wants a clean, safe bed to be in for the next year.
Yeah.
And let me know when I can have her there in 2 hours.
Okay, sounds good. I'll let her know.
Detective Rubner has helped rescue many young people and adults from the sex trade across Canada. Many are being trafficked. But it's a difficult crime to fight.
The internet has made things exponentially more difficult. Airbnb has made investigations exponentially more difficult. It can be daunting, particularly for the victims. They're going to have to go to court and tell their story probably now for the third or fourth time, and this time, their alleged abuser will be in the same room with them.
The detective works very closely with Reset, a year-long Calgary program for survivors.
There's a trafficking survivor that's arriving from Vancouver, and she's going to be entering the program at Reset.
We pick up a caseworker and are now headed to the airport.
What will she be doing her first few days?
A lot of it's just stabilization, just getting meals in every day, getting a good sleep.
Welcome to Calgary.
Thanks so much. I had to pack up my whole life and put it in 3 bags, and it was so overwhelming.
This is Selena, not her real name. She's 22 from Abbotsford. She broke free from her pimps and is now determined to leave the sex trade and her addictions behind.
I just feel like I'm a sex object, that I'm not valuable, and that was just what I felt was normal.
You're driving her to her new home where she will stay for 30 days with other survivors before transitioning into another Reset house and continuing her treatment.
I'm so ready. 1000% ready, and there's nothing that's gonna stop me. I need my worth all in all. I'm not gonna live in the stigma anymore.
An optimism encouraging to this detective.
My attitude towards sex workers has done a 180-degree change. Every woman has a story. Most of them are heartbreaking. If we can play any part in changing that narrative, then I think we've accomplished something.
Jamie Dahl, Global News, Calgary.
And that is Global National for this Saturday. I'm Robin Gill. Tonight, your Canada is Fortune, Newfoundland, and Labrador. Thank you for watching. Good night.